Welcome to the Black Health Matters podcast. I'm your host, Daly-Mack, RN, and today we delve into a topic that affects the lives of many North Carolinians, Medicaid expansion. Buckle up as we explore the history, changes, and impact of this program in our state. Part 1. The Origins. Ladies and gentlemen, let's rewind the clock. Back in 2010, the Affordable Care Act, or ACA, was signed into law by President Obama. One of its provisions encouraged states to expand Medicaid coverage to low-income adults. But here's the twist. It was optional. North Carolina faced a pivotal decision to expand or not to expand. And for years, our state grappled with this question. Advocates championed expansion, emphasizing improved access to health care, while opponents raised concerns about costs. Part 2. The political battle. Fast forward to 2013. Governor Pat McCrory was at the helm, and the debate raged on. The General Assembly was split, and the issue became a political tug-of-war. The battle lines were drawn. Democrats pushed for expansion, citing the potential to cover hundreds of thousands of uninsured North Carolinians. Republicans expressed fiscal reservations. And so, the stalemate persisted. Part 3. The turning point. In 2019, a glimmer of hope emerged. Governor Roy Cooper, a Democrat, renewed the call for Medicaid expansion. He argued that it was a moral imperative. The tide shifted. Public opinion swayed in favor of expansion, but the General Assembly remained divided. Then came a breakthrough. Bipartisan negotiations. A compromise bill emerged, but alas, it was vetoed. Then. Part 4. The present and future. Fast forward to December 1st, 2023, when Medicaid expansion finally became law. Since the expansion of Medicaid in North Carolina, more than 311,000 people have been enrolled in the program. This significant step aims to provide health coverage to a broader population, particularly adults aged 19 to 64, who earn up to 138% of the federal poverty line. For example, singles earning about $1,730 per month, or families of 3 earning about $2,970 per month. The expansion includes comprehensive coverage, encompassing services such as primary care, hospital stays, maternity care, vision and hearing, dental, oral health care, and more. For those already benefiting from full Medicaid coverage, there will be no changes. If you were paying attention, this episode focused heavily on policy and dollars, and there was little mention of actual health. I need my listeners to understand that policy has a huge effect on healthcare in America. It took 13 years for Medicaid expansion to happen in North Carolina, and sadly, there are other states that have not made it a law yet. It took 13 years of people who are not medical professionals, but were elected to represent us, to argue back and forth about whether you or your loved ones deserve health care. For those who have asked why they should vote, here's a reason. Elected officials can have an impact on your health. Find out who really represents you and vote. Let's continue advocating for equitable access to health care for everyone. Thank you for tuning in to the Black Health Matters podcast. Remember, your voice matters. Your health matters, and together we can make a difference. Stay well, stay informed, and stay empowered.